Did you know, in the United States, a heart surgery can cost over $100,000, enough to buy a small apartment? The United States, advanced but crushingly expensive. The U.S. healthcare system is globally renowned for cutting-edge technology, top doctors, and world-class hospitals. But all of this comes with staggering costs. Some studies show heart bypass surgery, $100,000, $120,000. Knee replacement, 1,300,000到1,600,000. Childbirth normal delivery, 1,100,000 with complications, up to $25,000. Type 2 diabetes care, about $9,500 annually for medications, tests, and devices. ICU stay, $3,000, $10,000 per day. Insurance exists: Medicare, Medicaid, private, employer-based. But even with insurance, seniors often face thousands to tens of thousands in out-of-pocket expenses. Some experts argue this complexity leaves older Americans living in fear. With insurance, you still worry. Without it, you hardly dare go to the hospital. China, more affordable, uneven quality. China's healthcare is far cheaper, thanks to state-regulated prices and large public hospitals. But quality differs sharply between urban and rural areas. Typical costs: heart surgery, $20,000, $30,000, knee replacement, $10,000, $15,000, childbirth, $1,500, diabetes care, $2,000, $3,000 annually. In cities like Beijing or Shanghai, top-tier hospitals rival many in the U.S. But in rural areas, patients may travel hundreds of kilometers for advanced care. Some reports note patients often pay extra for faster service or access to elite doctors, revealing gaps in equity. Vietnam, low costs, broad access, but overcrowding. Vietnam's public health insurance, BHYT, covers most citizens, keeping healthcare costs very low compared to the U.S. or China. Examples: heart surgery, $7,000, $1,000 out of pocket. With BHYT, patients may only pay a fraction. Knee replacement, $5,000, $7,000, childbirth, $300, $500 in public hospitals, $1,000, $2,000 in private. Diabetes care, $300, $500 annually, with generic drugs and BHYT support. Strengths: affordable costs and wide insurance coverage. Weaknesses: overcrowded public hospitals, uneven quality, and disparities between public and private services. Side-by-side scenarios. Scenario 1. David, 70, U.S., needs knee replacement. In the U.S., $50,000. Even with insurance, he pays $8,000, $12,000 out of pocket. In China, $12,000. With national insurance, he pays about $5,000. In Vietnam, 1,600,000. China compares childbirth costs: U.S., $12,000. China, $2,000. Vietnam, high-quality private service, $1,500. Scenario 3. Nam, 68, Vietnam with diabetes. U.S., $9,500 year. China, $2,500 year. Vietnam, $400 year. The result: the U.S. costs many times more than China or Vietnam. Medical tourism, patients crossing borders. Medical tourism is booming. Many Americans, Canadians, and Europeans fly to India, Thailand, Vietnam, or China for surgeries at a fraction of U.S. costs. Examples: heart surgery, $100,000 in the U.S. $8,000, $12,000 in Vietnam. Knee replacement, $50,000 in the U.S. $10,000 in China. Some packages even include lodging and vacation services. Experts note cost savings drive this trend, but risks exist. Language barriers, different medical standards, and uneven quality. Insurance systems compared us, complex, fragmented, and costly. Medicare covers much but not all, forcing seniors to buy Medigap or Advantage. China, national insurance covers most basic services, but high-tech procedures and imported drugs often require out-of-pocket pay. Vietnam, public BHYT covers most essential services, but premium care, private rooms, senior doctors requires extra payment or private insurance. Patient experience: us, fast, personalized, high-tech, but terrifying costs leave families anxious about bankruptcy. China, excellent care in big cities, but rural hospitals are overcrowded with long waits and inequities. Vietnam, affordable and accessible basics, but overcapacity and uneven quality remain issues. The global lesson comparing U.S., China, Vietnam highlights three models: U.S. highest quality, highest cost; China, moderate cost, uneven quality; Vietnam, lowest cost but infrastructure challenges. The key takeaway: a perfect system balances cost, quality, and fairness. No country achieves all three, but each offers lessons. The cost gap between the US, China, and Vietnam reveals a global paradox. The same treatments can cost 10 times more depending on where you live. So what's the right path for seniors? In the next part, we'll ask, can we combine the strengths of different systems? U.S. technology, China's insurance reach, and Vietnam's affordability to build a model of senior care that is fair, affordable, and dignified. Don't forget to like, subscribe, share to join us on the journey for healthier, happier golden years.